much for staying with us. We are back right here on Sun Up on Shobiz TV. Coming up is a well-being segment.
Running around, throwing that dirt all on my name. 'Cause you knew that I'd call you up. You go around, every party in LA.
When it comes to matters with health, I cannot do it alone. And so I am super excited because we are having someone that Auntie Vida Asante. She's here with us. She's a midwife, a health professional, and it's good to sit, head to head with her, have conversations with her. And so this morning I'm super excited to have her on the show. You are welcome. Na den na yehu wache sa. Woko shehi. Ahofe so aye overload. But I'm happy that you are here because constantly we are educating ourselves on our health. Some of the health diseases or health conditions even plaguing us, we may not know. We may not know the causes, we may not know some of the signs and symptoms, and so it's good that we talk about it. This morning we are talking about asthma, and this is a health condition that growing up in JHS schools and even senior high schools, you see a lot of children, a lot of younger people, being plagued by it. And some of these people that I came across, say fashion. Because they have their inhaler and then small time we better and all of them will be using it and all of that. But today I'm super excited that we get to educate ourselves, get ourselves abreast of all of the information. For me, the thing that I knew is that it's a chronic lung disease that affects all ages. And so it doesn't matter if you are 60 years, if you are 50, if you are 15, 20, just say all ages you can find yourself there. And I think I've experienced one person in class, somewhere in JHS, and at the time she had an attack and it was so difficult for her to breathe. And since she was not having an inhaler, they tried to do something, I forgot, but to tell you that I've seen some of these things, but we are happy you are here. First of all, in you being a health professional, what is asthma?
Okay, so I would say asthma is a condition in which the airway is inflamed.
Okay.
Yes, and then it becomes narrow and it produces excessive mucus. Making it difficult for one to breathe. Yeah, so the narrowing of the airway as it has been inflamed and then producing excessive mucus, making one person or making someone to not breathe well or making it difficult for one to breathe. That is what asthma is. So it's basically has to do with the lungs. Yes.
Okay, so when you talk about the airways, it's just the lungs you're talking about.
Lungs and yes.
Okay, so meaning that if someone has difficulty in breathing, definitely it will be because of some of these reasons that you're talking about. But let's go into it more. What really causes the lungs to fail at that point?
Okay, so I would say the lungs hasn't failed yet, but I would say it's having difficulty in achieving its purpose.
Okay.
Yes, because the lungs is for exchange of air. Yes. So this time round, one can have such a condition if the person has been exposed to chemicals.
Okay.
Yes, we have these chemical irritants, and then it can be inherited from one's parent.
Asthma can be inherited.
It can be inherited.
Wow.
Yes.
I didn't know. I thought that people pick it up, just like you're saying, if they're exposed to certain chemicals also. Wow.
And then we have severe respiratory diseases in the childhood, or when one is a child and the person has been exposed to severe respiratory infections on several occasions, that person can also get asthma.
Wow. So when you talk about chemicals, is it, many of the things that we use in our household, a lot of them are filled with chemicals. But at the end of the day, they are made friendly to our skin and also to what they are using them for. Especially, there are so many soaps out there. There are so many body creams out there. So would you say that all of these are a causative factor?
I would say yes. And the most of it is from this, I'll say industrial waste.
Okay.
Yes, in Africa here, taking Ghana to be precise, initially we were having this industrial area where where things are being processed. Yes, and such places there were no settlements, but now we are growing. Yeah, and we are expanding as well. So a lot of people have their houses closer to industries, and you can imagine being exposed to a chemical a particular industry is producing for a very long time. It can expose you to such a condition. So I would say that the ones we are being exposed to in our homes are not so much that can
Harmful?
yes, that can harm us or expose us to such a condition.
But let's look at the signs and symptoms. What are some of the things that we are likely to experience? Maybe you'll be with fear or experiencing your be we who be who your be called or then a ditcher say asthma echo but nim say asthma. What are some of the signs and symptoms that they're likely to experience?
Okay, so like I say, once asthma no, yeka lungs no, niche say one common idea will be asthma, obe experience here say obe bowa.
Okay.
Because first of all, most no, there is narrowing of the airway. Baby uhumia inframani nama eko umu a epi no. Sisi ayeketwa because ahono ena kwan na edem na ayeketwa ena e produce amaman anase mucus.
Okay.
Oh, e bruise unti na ma humia ni nsi so. Nti yes utimi bowa there is cough. Ena since ahumia no humia ensi so ni so I said there will be wheezing in your breath. I say uhumia no uti say mframa bi epie enye normal. Afen so no uhumia obre. We say yati ha ye humi you are taking in our normal air and then exhaling. Obi ehu but unya sa condition na uhumi obi ehu say uhumia humi na obre because mframa na wo fa no unya dodo na e wo say unya our system nim. Nti bibisa no uhun bibisa on say nipa no enya attack bi o ha because mframa na all fan indoors ninzi no e maninya bluish fingertips. Yes, because one say there obi ni moja kra uhu ni se wo hwe ni se motimu so ni pe ni moja even na no kra more red lips especially one say na no color no kra ye fita and say atani to blue one say ni pa ni moja e na moja na ade pa kon so edi akosi ni moja ni mpa ma moja ye oxygen.
Okay.
It is here who take in oxygen na enya adequate for the body no. To be honest, our extremities now are bluish because our breast will be taking in more oxygen. Into science, they are making be a science. Which means any panel, any asthmatic attack. And now home yearners know who mean 10 because they are all finding also. Until we are not far for we are not far for to know there is excessive breathing.
When I was growing up, and like I mentioned, JHS and senior high schools, those that I saw in class that had asthma at the time, they were not allowed to partake in duties like sweeping. Is it that when you have asthma, you're not supposed to get close to dirt? Because some of us, we still sweep, and we were still sweeping at the time. And then you realize that these people are, categorized in a certain way that, okay, so they are not going close to sweeping. They are not going close to any sort of hard work in school. Why is that?
Okay, and yes, hard work, not necessarily hard work, but something that has got to do with dust.
Okay.
Yes, so someone with who has episodes of this asthmatic attack or is a known asthmatic should desist from dust or dusty environment, because it's one thing that um, brings up or brings about the attacks. Yes, so you avoid dusty environment. Until na such nkrofo no, eba say ye pra na say ye koye reading bibia
They don't take
because
part.
it triggers it to start.
Okay, okay, so that really explains it, because those times we're really getting angry at them. But it's good to know that it's finally a way of helping them as well. Let's talk about the ages. Earlier I mentioned that per my little, reading I did, it affects all ages. But you know that when you are growing, there are certain health conditions that you are also likely to be exposed to. At what point does asthma become very dangerous? At what age does it become so dangerous for a person?
Okay, so I would say at any age at all, it can be dangerous. Yes, because at an early stage, one can have respiratory infection, and uncontrolled, or if it's not well treated and it's recurrent, the person can have asthma. So at any age at all, you can have it. And if it's not well managed, you can get to the worst side of it, which will cause harm to you.
Wow.
Yeah.
So how long can a person live with asthma?
Oh, so I'll say you can live for long, provided it is well managed, even 80 and above, because asthma is a kind of ailment that cannot be cured, but it can be managed. It's just like someone with diabetes or hypertension. No, it's not cured, but it can be managed to you get to your date, I would say God has given you. So some can cross 80 years if it is well managed.
Wow.
Yeah.
And here I was going to ask you what can asthma be cured, and now we get the response.
Yes.
Nothing can be done.
Nothing can be done.
But you mentioned management and treatment. And so if a person is having asthma now, or if someone is watching and the child is experiencing such symptoms or signs, or even if the parents themselves are experiencing the signs and symptoms, so first of all, what's the diagnosis process like?
Okay, so for one to be diagnosed of having asthma is medical.
Okay.
Yes, because you can have catarrh, cold, and then you can even try to attribute it to asthma. But at the hospital, it can be diagnosed because there are some labs you have to go through, and then some diagnostic investigations that will make you be diagnosed to be having asthma. Yeah.
So you can't maybe be at home and assume that I have asthma because you're just having difficulty in breathing.
Yeah.
You have to go to the hospital first. And after you've been to the hospital, and this is what you are told, that finally you have asthma, what is the process like? Is there a treatment process? How can you manage it?
So I would say there should be a lifestyle modification, because I said earlier that maybe you are in an environment where there is production of, or there is more production of chemicals that always exposes you to have the attack. So I think you staying away from such environments will help you. And in treating it or managing it, they normally give bronchodilators, medications that dilates the bronchioles or the lungs for easy breathing, because you are having difficulty in breathing. So they give you those medications to help dilate it, so that at least you can take in more air freely. Yes. And then there are some techniques you are being taught
Okay.
that when you have the episodes, this is what you should do if in case you don't have those medications
with
on
you.
Yeah.
And so this takes us back to when I mentioned that I saw a student in class having, you know, an attack, and then the teacher came around. They have forgotten really what they did. So what are some of the techniques that you should adopt when you are exposed to that?
Attack. Okay,
Or maybe when someone around you is exposed to that just then?
So I'll say in that environment, maybe there was something that triggered it.
Okay.
So first of almost, the person should be taken away from the triggered or the triggering factor, and then sent to a place where the allergies, like what triggered it, is not around. And then you let the person sit in an upright position. Because when you are sitting upright, it makes it more easy for you to take in air. So you sit in an upright position, you relax, and then be less anxious. Because you know, when you have that episode, you become anxious because you don't know what will happen next. So you become more anxious. So you try to make the person relax, and then sitting in that upright position, the person can take in more air, because the narrowed airway will be a little bit relaxed. Because when you are anxious, there's more contractions, narrowing the airway. So being relaxed will dilate it a bit. And then it is advisable to take in hot tea or any tea with coffee or caffeine in it, or even coffee, warm coffee.
Is there any special reason?
Yes, we have a chemical in it that helps the bronchioles dilate, or the airway dilate. That's according to research. Yeah, so when you take in tea or warm coffee, it helps you in that manner. So,
what of someone that has been used to an inhaler all their life? Can they treat asthma without the use of an inhaler? Because at a point, even in school, it became like fashion. And so can it be something that the treatment process can do away with it, or always is that one thing that you should carry with you?
Okay, since you've been diagnosed with it, I think it's best you always carry it with you, because that is a bronchodilator. Because as soon as you inhale it, it dilates the airway, and then breathing becomes a little bit easier for you. So you should always have it on you.
You should always have it.
Yes, because it can kill you actually. If you get to the worst stage that you are not being managed by the right people, you can lose your life. So you should always have it on you.
What's the time frame for people having attacks? Because you realize that someone will be fine maybe for days, and one day you don't know what will happen, and then suddenly they have an attack. What's the time frame? Does it happen maybe, in a week you should have maybe a phase? What is it like?
There's no time frame for the attacks or the episodes of having it, but at any time at all, one can have it. Yes, you can have it in the morning, you'll be relieved, and then in the course of the day, it appears again. Because maybe you've been exposed to something you are not supposed to. Allergies. Because there are some people with allergies that triggers it. So you have to identify things that you are allergic to. Because some people detect for themselves that if I use this particular spray, I get the attack, or if I'm exposed to smoke or dust, I get the attack. So you do your possible best not to go near places where such things are, so that you didn't get the attack.
Wow. Are there certain types of foods that people living with asthma should not go close to, should not eat? Is it asthma? The maize buns, don't touch this food. Is there anything like that?
Like I said, but one kasa nipeduano, who say, maybe I could do fruit, and I'm in attack. Fine, be 1 week a tram, 2 weeks a tram. Who say repeat the same fruit, and I aduane when you attack. Until now, if you want to say, maybe aduane with me, dear, and boame. Until you shed a near aduane, and I say, Bibi potty, I make us say I did with me, dear, and I mean asthma, and I say, when your attacks, Udi ya no ho anje no, then you desist from it.
From it. Are there any sort of medications that are likely to trigger or worsen the situation of someone having asthma?
Oh, okay. I would say there are some medications of which I can't mention them now. And that's why when you go to the health facility, they normally ask of if you have any medical condition so that they know the particular drug to administer to you for the particular ailment you've taken there. So there are medications that triggers it. So you just be in a known of such medication and then you tell your health practitioner so that medications wouldn't be used on you.
Not be used on you. When it comes to children and adults, grown-ups, in terms of the treatment, are they administered the same medication? Because you say akwala body dey drew baby a penny, your immune system very different. Until Wobeka say children are on different medication when it comes to having asthma and older people too, or they are all administered the same type of drugs?
Okay, so they are all administered the same type of drug, just that the dosage is different.
Okay.
So when finally say penny how a full cup of that medication a try chronic age near reduce your man send a bayan system no and then to the same medication but different dosages.
What kind of environment should someone living with asthma be in? What kind of environment? Is it a ventilated one? Is it one that all windows should be closed so that they prevent some dust from coming in? How should they live?
So I would say you have to prevent stuffy environment. Wa share them na share how wa nkasa wura hokra homi ayensi so. So wo hihye oniema ye se na be ya mframa ebetimi circulate ebia wo dusty place and I say baby a wo fie ni wo no efa say e wo kwan ho baby a yenye road no tem bia wo say futu wura dan nim nti is advisable say be close windows tem be make sure say windows no ya tomb because that's na wura dan nim no definitely be settle on surfaces nti there wo ho a be settle on them nti ebia wo ho ka na say that's nipia na fe a trigger attack no so we make sure say always the environment is clean and tidy and then you arrange things in an orderly manner to prevent crowdiness in a particular environment and then breathing in dry cold air is also one thing that triggers the attack until we na
now what balance in that sense is definitely very important. Let's talk about people that have attacks at very odd times. Why is it so? Maybe a bit or down much, maybe at the same 11 p.m., 12 a.m. or beyond. Now the person will suddenly have an attack. Why is it like at all times like that?
Okay. So one say nipanga sano, one say oh da. It's advisable say yen shadi a beche because nipa udape muscles ni na relaxing. So muscles from head to toe muscles ni na is in a relaxed state. So the same thing applies to the lungs, the airway, everything. The beer has to do with the body has relaxed. You know, it will cause more narrowing of the airway. Tebema airway na ya kitwa because this year no muscles ni na relax. You know, and the man crofopy tanya attacks in their sleep because of the relaxed muscles.
And also idea it was say
when himself will be our asthma. When making sure say oh koda ebia obi o pillow before obenyano ebia onye obi a oda outer use pillow.
Okay.
Oda on a flat surface, oda bed ni so sa flat pillow. But this time round, you diagnose you know that making sure say you will be in a proper position. Ebia usru na peja kakra say oda. Sometime back, many lady be your call outreach program. See, na me kra me sure ye my one hotel room. Nti ye beda na afi lady no. Wa hihye ofa pillows na wo bed ni so nyina na afi oda pillow ni so like na ase oti honom na wada. At a point na me sure say ade na nko ye beda no. Ade chi ye no. Na me bisa no say o condition bi say. Nti say oda na say wanda sa obre. Na me nti so when him say you diagnose yourself with asthma, on that flat. Because and them no muscles need na relax. You know, difficulty in breathing e wo honum. Because baby a wo home fa no na I relax ye jejai no ho. Nti me akwan na wo home fam no be ketua. But o say wo ya tena se kakra no, akwan ni mu abie.
Okay.
Nti esa wo ntanya attacks no.
This has got me thinking, can someone live with asthma all their lives without even knowing? Yeah, or a bit more sa condition and they may not even get to know. Or they be call hospital cry so that they get to be diagnosed. Some people can some people live with it. Maybe they may just be experiencing difficulty in breathing, but it may not be in the form of attacks and all of that.
You have to know because
Okay.
it's not normal not to breathe normally. Yes. So while share have our own home no. And yes, like one say oh bre. Home near the anka find it simple. But this time around oh me bia oh bre. I say chest no I very I say you are very chesty. Say mama ejina mu oh bowa ne kra mama ni nyina amba oh home a oh bre. Mframa ne breast of mframa nti definitely we hu say no or say me call hospital nti okwa then you be diagnosed. So you can't stay say oh hono unim say oh asthma ubehu because humya ne nye papa.
Okay. Pacho, ye per se wo lungs no at the point no a damaged na. Does your lungs get damaged, you know, when you have asthma?
I would say yes, it can. Because you see, I don't say the irritation, constant irritation of the lungs, which is not well managed. When you attacks, maybe a facility or corner, you need the right medication, you can be on. Then be a better help, say lungs, no be here, in a normal way. The time there is irritation of these lungs. Well, because the lungs and the airway gets inflamed. I say you crab them. Well, I am narrow like sir. When finally says sir condition nankasa no time be frequent and always having that attacks. And my lungs linear scar. Yes, it forms. There's a scar formation in the lungs.
Okay.
Into no a very big lung remodeling. Into no about is the actual state, and I said the normal lungs are now one shape necessary because you see, there has been more scar formation in the lungs.
Okay.
I'm making it more narrow. There has been a lung damage. So, no, who ya say, when ya attacks now, men can say, maybe a be ya me bano, a man the way in a call. You have to manage you well. You manage you then there'll be a lung damage.
And we actually don't want that to happen also. Wow, this is very eye-opening for us to discuss all of these things and get to know how best we can even help ourselves. Let's talk about death rates. Is it high? Is it low? Is it maybe in between? How is it like for people living with such condition?
Okay, so in addition to the scarring of the lungs, you know, you can have pneumonia. Yes. So the death rate, I would say, it depends on the treatment regimen. Because now a lot of people are in the known of going to the health facility to seek for health care. And now that we have the health insurance in the system,
Exactly.
until now, if you in your condition, I feel say, so death rate has decreased because when we say I have this condition and I don't have to sit at home and manage it because there are complications and if it's not well managed, I can die. You know, nipa bebree seek medical attention, which has really reduced the death rate.
But Auntie Vida, I'm also thinking about people who are working in fields that are exposed to certain chemicals that you mentioned, like our industries, a lot of industrial areas as well. People that are prone to, you know, so many things going into them. This is the work they find themselves in. They don't have asthma yet. How can they protect themselves to even, because constantly there's an industrial location somewhere, I think they deal in soaps somewhere in Cape Coast, and even it's called Amin Sangari. And anytime you even drive past the place or you walk past the place, you are not even in it, but wow, and kana to me raw, and you have to maybe walk past it, crab mouse, you know, stand at a particular point before kakra, it will finally, you know, leave you in the state that you were before. People that are so much exposed, what can they do? Can face mask help? What are some of the things that they can do?
When you say, oh, you may be an answer, maybe a year job, don't say about protective clothing. So, you may be the kind of clothing share to protect you, because the beer, no, I say, hospital setup. If you know where delivery cry, ideally, I would say, yes, she share you want to say COVID by no, who have our attended to a COVID client, Sir, now even we delivery, I was show
Protective clothing.
Protective clothing. So, environments, baby, we have protective clothing to prevent you from such exposures. Ebia, oh, baby, you train just sawmill. Say
Constantly.
so
Dust, no.
Or social mask. Or share goggles, like, but in people had they overlook such things. Or feel say, oh, my main trying to see an amenco, oh, my minion is see an amenco, and no one putting at more risk. Until all environments be sana, also protecting because I think, say, they are or establishing a company in him, say, these are some of the harm and dangers in getting constant exposure to such chemicals and, you know, almost providing those protective clothing. Okay. Also, courage man make sure say wash it
in that sense, because there's so many people that because at the end of the day, what nya say sika na what they be treaty, and so I think that it's very important that we don't overlook such things. And someone was asking, does smoking, you know, expose you to asthma?
Yes. No. Smoke, you are inhaling into your lungs.
Okay.
So it exposes you to asthma.
Wow.
Yes.
Wow. So these are some of the things that we should look at. Auntie Vida, we've had a very thorough conversation, but finally, your words to many people out there. There are so many people, a bit of marketplace, a bit of fear or share no power. Maybe their child is experiencing such symptoms, or even them, but they are just afraid because they feel like people will say that I have asthma, so they don't even want to. What are some of the things that they should do? A lot of times we are even too careless with our own selves.
So the American say, when your condition way, and I say oba will be. So also making sure that thing be a dining room very neat and tidy. And it's advisable to say, even bed linen or bedasso, bedasso, and as a cranny bedasso, with pillow sleeves, making sure say the type and dust. And then you avoid this use pillow the feather. You so the pillow there be penny the feathers, and I say now you avoid it because it be a dust.
Okay.
Then I said that's one thing a trigger nipa manager such episodes. And now obe prevent say unse bi wo ha me pet and I have a pet me pet maybe or a dog or a cat. or pets into the extent say it me my pet need an chair on the bed so yeah diagnose you and say person benya such a condition and that's our practice you should avoid it so you avoid pests being in your bedroom because almost never be if your it triggers it and I say such conditions.
Wow. And finally, you mentioned that it's hereditary, meaning that a mother or son, husband or father it can be from them to their children. And so how can we avoid that?
Hereditary there, like I said, since a word was your name, meet me about say, Miss me, it's any na meshe niema a deba.
Okay.
Niema, oh yeah, betting yama when your episodes no. Inti say, me feel say, me a try me mama who say, dusty environment, say, if you are keeping pets around me doesn't help. Using pillows and bed linens that attract more dust wouldn't help her. Then I desist from all these things. In Tebema, so no, I bought me home by and say, me in such a condition. I say it will be when you say family no diabetes. And so social lifestyle, who feel Indiana, who di, like who get, who show lifestyle. I just say you want to channel a course to getting such a condition. To one so social lifestyle now they are modify or say never ya condition bisa.
Definitely.
And I learned say there are some exercise like getting.
Okay.
We exercise be like exercise it me and maunya such episodes of attacks. Until also work school, maybe our boarding house. Now there's this games near the hey just men can men be because attacks.
Attack. Wow, I hope that we've really learned. Thank you so much, Auntie Vida. We are hoping that definitely we'll be having you come from time to time so that we constantly educate our viewers.
Let's say me was date view said
hey date no was say hwehwemu because you say health professionals health professional they can date for but God bless you so much for making time. We're wishing you the very best today. Enjoy the rest of your morning. That's Auntie Vida Santi right there, midwife, and we've been talking about asthma and what it even does to our bodies as human beings and how best we can even alleviate ourselves of the struggle with asthma. It's very real. Children are suffering from it. Older folks are suffering from it as well. And so mind where you are, mind the lifestyle, mind the things that you take in, and make sure that you get treatment so that it is managed. If not, the attacks are going to be more, the episodes are going to be more. We need you alive, and so protect yourself in that sense. We're going to go on a quick break. We'll definitely be back right here on Sun Up on Shobiz TV. Do stay with us.